Hey guys, it's Sarah here. In this video, we're going to be going over fundamentals review. And this is all about the patient care. So it's going to involve nursing team, nursing care, delegation, everything under that. So let's get started. Okay, in terms of the nursing team, you want everybody to work together. You need a team where everyone has trust in each other, communicates effectively, and collaborates. By collaborates, they have to collaborate with the physicians, with the techs, with everybody, not only nurse to nurse. And this whole nursing team begins with a nurse executive. The nurse executive is a person on top of the whole thing, and they're in charge of not only the finances and making everything work, they're making cost effectiveness. They're also in charge of clinical. They're in charge of, are the nurses where they should? Do they, let's make everyone get masters, let's help everyone through this, is this person. They're basically in charge of everything. They're the director of the nursing. Okay, so now we talk about delivery methods. So it's nursing care delivery methods. We used to have the transitional model. And what the transitional model was is that you had team nursing and a primary nurse. So the team nursing is that the nurse wasn't the leader of the team. And under them, everyone divided the tasks. So the nursing assistant would do the vitals, etc. And the primary nurse would be the nurse, and they would be in charge of the whole patient. So they would do everything for the patient. The problem with this model is that you need a lot of nurses to do that if you're making the nurse responsible for everything. So it got very expensive, so we go on to the next model. The next model is today's model. Today's model includes these 3 points: patient and family-centered care, total patient care, and case management. Patient and family-centered care is basically, the goal of that is to respect and for dignity for everybody involved. You want informed sharings, you want to update them on what you're doing, you want them to participate in the goal, let you know what works for them, and do it accordingly, and collaborate with them. Then that's honestly the best for them. It's the best for you, because you don't want to try something and make a goal for them and then, hey, it didn't work, because guess what? They're not going to keep it. But they could have told you that, and you could have switched it at first. Total patient care is when the nurse is responsible for the patient during the shift of care. They could delegate, but they're responsible for everything. It's not so cost effective because, like we said before, the high number of nurses, but the patient satisfaction is very high. Next, the case management, and that is just like a case manager. A case manager is basically someone who oversees everything of the patient. It's, they advocate for the patient. They try to get home health for the patient. If the patient's homeless, they don't just send them home with medication, because they go the further step. How could they get the medication? They don't have insurance. How are they going to keep up with that medication? Do they need an assistant? Do they need a shelter? They do everything for the patient from the start to the finish. Okay, now we go on to decision making. In terms of that, we want the decision to occur at the staff level, not just like management is in charge of the decision. In terms of making a decision, it includes responsibility, autonomy, so their independent decision about the patient care. Authority is the power to give commandments and make a final decision. And accountability, which means that you're going to answer for whatever you did. The staff should always be involved in decision making, and it shouldn't be just like the top person doing it, like I said before. Okay, so these are leadership skills for nursing students to have. Number 1 is clinical care coordination. So clinical care coordination is basically making clinical decisions, prioritizing. If someone comes in with a cough and someone else comes in can't breathing, you're obviously going to take care of that person first, even though the person with a cough, you could have helped them in 2 minutes, but you're going to prioritize everything. Basically prioritize what needs to be done now and what could be done soon. You want to use the resources, and time management is all part of this. Next, we go on to another leadership skill for nursing students to have, which is team communication. In terms of team communication, you want to respect others' ideas, not just only say whatever I say goes. You want to stay informed, and you want to share your information. In terms of the next leadership skill, so that is the delegation. In terms of delegation, we're going to have the next slide to go into the 5 rights of delegation, but for delegation, you always should know what you could delegate and what you can't. For instance, you can't delegate to give IV antibiotics to a nursing assistant. Even if they say they know how to, you can't delegate. So you have to know what you could and what you can't. When you do delegate, it's always your responsibility. So even if you gave it to them and they're the one that drew the blood, if they mislabeled it, it's on you. So that's why you have to know, is it the right person? Are they skilled in it? Do they have the knowledge? And can they legally do that? And then we go into knowledge building. So knowledge building is something that we are lifelong learners. Even after you pass the NCLEX, even after, if you think you know everything, there's always more to know, and the more you learn, the more you realize that you don't know. Okay, next we go on to the 5 rights of delegation that we mentioned before. Number 1, right task. Is it within their scope of practice? Number 2, right circumstances. Is the patient stable? Is it a non-complex task? Do we have enough staffing, resources available for them to do it, etc.? Right person. So you have to assess their competency before delegating. So you have to know that they have, a certificate or whatever they need, and they are able to do it. You have to assess their knowledge, their skills, their ability to be able to do it. Right direction. The nurse has to provide clear instructions, like, for instance, telling them specific patient what to do, what to observe back to them, what exactly to tell them. And the person who's going to take the task, for instance, the nursing assistant, should verbalize understanding. And they should also have the ability to ask questions if they need. And last but not least is the right supervision. The nurse is always accountable for the action. So if they're going to draw blood for you and send it up, and something's going to be wrong with that, it's under you. It's your responsibility. So you want to monitor, evaluate, and intervene if they're doing something wrong. So that's it for this section. Thank you for watching. Subscribe so you can stay tuned for the next fundamental review.